Hi everyone, this is Ryan from rpnt.ca, and today we're going to be talking about the drug Ipratropium, also known as Atrovent. You can use the timestamps in the video description to jump ahead. Ipratropium belongs to the Anticholinergic drug classification, also known as cholinergic antagonists. Let's talk a little bit about anticholinergics and how they work. Acetylcholine is the main neurotransmitter involved in our parasympathetic nervous system, also known as the rest and digest nervous system. Acetylcholine is where the name anticholinergic comes from. So, acetylcholine normally binds to the receptor sites in the parasympathetic nervous system, causing rest and digest functions. Normal rest and digest functions include increased salivation and digestion, decreased heart rate and blood pressure, bronchial constriction, and more. Ipratropium is an anticholinergic, which means that it blocks or inhibits acetylcholine binding sites, which causes the opposite of the rest and digest functions. So, ipratropium would cause decreased salivation and digestion, increased heart rate and blood pressure, bronchodilation, and more. You can see that all of these effects are actually the effects you'd expect in the sympathetic nervous system, or the fight or flight nervous system. Again, that's because ipratropium is an anticholinergic, so it does the opposite of rest and digest. Now, ipratropium is often administered as an inhaler or nebulizer, rather than say a pill or injection. And inhalers generally don't produce systemic effects, which are effects that you'd see throughout multiple systems of the body. This is because inhalers act locally in the bronchi. So the primary effect of ipratropium is bronchodilation, which is the widening of the bronchi resulting in a more open airway and making it easier for clients to breathe. Due to ipratropium's effect of dilating the airway, it can be used in the maintenance of asthma. Ipratropium can also be used in the maintenance of bronchospasms associated with chronic obstructive pulmonary disease, or COPD, which includes asthma, chronic bronchitis, and emphysema. Ipratropium has an onset of approximately 5 to 15 minutes, while salbutamol or Ventolin typically has an onset of less than 5 minutes. This is why salbutamol is considered the rescue inhaler for asthma attacks, while ipratropium is considered a maintenance or controller inhaler. Ipratropium is also available as an intranasal spray and can be used for the relief of rhinorrhea, which can be defined as an excess of watery nasal discharge. Ipratropium acts by reducing the amount of mucus produced in the nose. Some common side effects of ipratropium include a dry mouth or unpleasant taste in the mouth, headache, anxiety, and nervousness. Less common side effects include tachycardia, arrhythmias, and paradoxical bronchospasms, which is the rapid onset of bronchospasms shortly after administration of an inhalant. Paradoxical bronchospasms can be life-threatening and may occur with excessive use of ipratropium. As an intranasal spray, ipratropium may cause minor nosebleeds, likely due to nasal dryness. Ipratropium is a derivative of atropine, another anticholinergic drug. This is why ipratropium is contraindicated in hypersensitivity to atropine. Use cautiously in those with narrow-angle glaucoma, prostatic hypertrophy, patients who are breastfeeding, and more. Always remember to assess and monitor for side effects of ipratropium. You can encourage clients to rinse their mouth after use to help prevent dry mouth and unpleasant taste. During an asthma attack, remember to use a rescue inhaler like salbutamol to open the airway quickly. If your client is going home with ipratropium, always ensure they understand how to properly administer their inhaler by getting them to perform a return demonstration. A good general rule for inhalers is to inhale for 3 seconds, hold for 10 seconds, and exhale through the nose. Ipratropium can also be administered as a combined inhaler with salbutamol. This combination is known as Combivent, which produces a greater bronchodilation effect. In school, I was always taught that ipratropium inhalers are contraindicated in clients with hypersensitivities to soy and peanuts due to the type of propellant used, which was known as chlorofluorocarbon or CFC. CFCs are supposedly synthesized using plant oils like soybean oil and were actually harmful to the environment by decreasing the ozone layer. So, according to the US Food and Drug Administration, CFC propellants were phased out and replaced with hydrofluoroalkane, or HFA propellants, at the end of 2008. HFA propellants supposedly do not pose any harm to those with hypersensitivities to soy or peanuts. And that's about it for the basics of ipratropium. If you have any questions, please let me know in the comments or visit rpnt.ca for more help.